So now, moving from the studying medicine to the actual medicine, how was the people receiving medical treatment? Did they go to hospitals like now, or what they did?
I mean, when you talk about many years ago, the health service was not, of course, as advanced and as huge as what we have at the moment. There were very limited centers. In fact, there were only maybe one hospital to treat everything. Even at that stage, a lot of people depended on non-medical personnel. They depended on the local religious men, to actually help them to treat some of the disorders that they have. They used and they depended on a lot of herbal medicine, using non-formulary medication. The cautery was very popular there. They used it to treat, I remember, jaundice, which is one of the diseases that cause yellow discoloration of the skin. The most favorite way of treating it was cautery, just to burn the patient. Yeah, it was, and I've seen it myself. It happened to my uncle. He had jaundice, and I think that was just a mild viral hepatitis, which would go with time. But he was taken to a local, what you call it, medical expertise, and he recommended that we should be treated with cautery. And I remember it very clearly because I was very young and I was watching it. So they closed his eyes and turn his head back, and at the same time they were really heating a small nail until it became red hot, and then they just applied it to the skin, and you can imagine the agony and the pain. But that was one of the methods to do it, to treat people, as I said, as well as the herbal medicine. So very limited resources with that regard, but still there were hospitals, and then they became more popular as they increased in size and also increased in number of personnel, increased in number of doctors. So that encouraged people to go more to the hospitals, but nothing to compare to now with advanced technology and the most up-to-date methods of diagnosing and treating patients.
But speaking of the disease, of the heart disease, were there some radical diseases like you faced and you can't deal with it, so you have to develop it like in other countries to receive treatments?
Yeah, before, the commonest problem that was as far as cardiac issue, is really having the infection, rheumatic fever. Rheumatic fever can affect people at younger age, and the devastating effect does not happen until later on when this fever is not being treated properly. So what happened later on is stage that they will affect the valves. So a lot of adults will present with problem with their heart valves, being narrow, being calcified, being unable to function properly, and that was as a result of not properly treated infection. That's probably very popular at that stage. And indeed, you can still see people now, elderly people, having problem with their valves as a result of rheumatic fever, which they had when they were young. In general, most of the problems that was really, brought people into disease and the rest of it was infections. And there were not really proper antibiotic control and treatment at that stage. In contrary to what we have now, most of the problems, especially related to cardiology, is life acquired. It's the way of living. The way of living has changed completely, over the last 40 years. At that stage, coronary artery disease was probably very rare because the people led a healthy life. They ate healthy, they did a lot of activities by walking around, they looked after their body weight and the rest of it. So rarely that people actually had problems related to high cholesterol or obesity or blood pressure or even diabetes compared to now. So there is a difference in the type of diseases that has been as a result of the way people live
So of course, as a medical doctor, you face a lot of cases that maybe you are facing now also. So what was the hardest thing you face as a medical doctor in your life?
Yeah, I mean, the reason I really chose medicine because I like to treat patients, I like to listen to people, I like to be able to help them. It gives me great satisfaction of seeing people, you know, relieved of their pain, cured. This is really a rewarding aspect. So, as far as my job, as far as diagnosing and treating, this is something I enjoy doing. So I don't really face a lot of problems with that issue. However, when I actually finished my medical college in Dublin, I was required to also to do 1 year as an intern, which is a practical year in a hospital.
Mm-hmm.
I did that also in Ireland. I did it in a city called Limerick. And after that, I continued working there because I liked the atmosphere and I was learning a lot. The only thing I found very difficult at that stage was the long on-call hours. I remember that I was doing every third night on-call. On-call means that you go to the hospital at 8 o'clock in the morning and you don't come back until 5 or 6 o'clock in the evening the following day. And you have to do that every third night. So that was a bit tough. The worst bit of this is when you actually cover the weekend. Because the weekend in Europe is Saturday and Sunday. And when you start going to the hospital on Friday at 8 o'clock in the morning on Friday, you know, you have to cover the whole weekend. So you will be covering Friday, Saturday, Sunday. Monday is a normal working day until 6 o'clock. So I remember when I'm on call on the weekend, I used to take my bag full of clothes and maybe some food and the rest of it, because it's a 4 days journey. And that was difficult. By the way, this has been now stopped because it's really not ethical, you know, because it's really long working hours and the rest
Maybe
of
it
it.
will also affect your performance.
Yeah, but we were young, and as I said, when you like something, when you enjoy doing it, you do. I mean, yeah, there were long hours, but the atmosphere was made beautifully because you had good colleagues, you enjoy what you are doing, the atmosphere in the hospital was nice. You know, even late at night, 2 o'clock, 3 o'clock in the morning, you know, come back after seeing a patient, I see one of my colleagues, you know, is already, you know, just have a cup of coffee, I sit with them and we discuss things, you know, talk. It was fun. It was fun. Tiring, yes, a lot of work, a lot of physical, effort being produced and put into it, but it was enjoyable. And you're learning as well. And that's what made life really interesting. And that's why I managed to do it. Otherwise, it would have been very difficult to carry on.
So hard but fun.
Hard, but really enjoyable.